Welcome back to Forever Young, the show where we always teach you tricks about growing younger. Today's guest is Joseph Johnson again, and we're talking about whole body vibration. And we kind of left off talking about some of the wonderful benefits. And we were sort of getting into urinary incontinence and some of the female sort of issues that you've seen.
What we found is that the female population over the age of 60, there's a significant portion of those ladies who are suffering from varying degrees of incontinence, whether it be stress incontinence or just urinary incontinence. And this can be, really difficult condition to deal with, embarrassing at times. What we found is by having the ladies stand on the vibration platform, anywhere from 5 to 6 minutes twice a week, typically within a month, 90% of those cases are turned around significantly.
90%?
Yeah,
wow.
At least 90% of them. And typically they all see 80 to 90 to 100% resolution, too. So it's not just like a 50% improvement. Typically it's 80, 90 to 100. So about 90% of the patients that come to us are pretty much symptom-free, once we've gotten into it. Now, the time that it takes will vary, and the average is around 4 weeks. Sometimes it'll take up to 8. Sometimes a little less, depending on the degree of severity that the patient was seeing. What's nice about it is that it helps the patient forego any kind of pharmaceuticals or surgery.
Right.
And what's interesting is we've had quite a few patients who have come to us who have already had the surgery and who have already been using the pharmaceuticals to no avail. And by using the whole body vibration, every one of those patients has seen a resolution, without any surgery or additional pharmaceuticals. And the reason why is, even like with physical therapy, you'll see patients using Kegels and the like, and the shortcoming there is that it does not contract all the muscles that are non-volitional, and this will do it for you. So it contracts the muscles you can't control, and that's what allows for the patient to be relieved of the symptoms.
So I just want to touch on that, because when you say volitional, that's like muscles that we can will.
That you can do. You can contract with your brain.
Voluntary. Those are called voluntary muscles also.
Yeah.
But we know, within our system, we got lots of involuntary muscles where, fortunately, we don't have to continuously say, "Oh, heartbeat."
Right. Exactly.
Keep your diaphragm, keep breathing.
Exactly.
But also in the blood vessels, there's lots of involuntary muscles that keep the blood flow.
Oh yeah.
So there's in the digestive system. So
absolutely.
So this would, unlike normal exercises, this is going to exercise all those involuntary muscles.
Yes, it'll tone those muscles, and what's interesting about it is you'll see the case improve just like an exercise, a little bit at a time. Yeah. And each week they come back doing better, and if we pull the treatment away for a long period of time, the symptoms the problem will return, because the muscles have lost their tonus and they become weaker again. So as long as they are able to maintain this, typically once the situation's resolved, come to see us maybe once every 2 to 3 weeks for just 5 minutes. We'll allow them to maintain that too. So it doesn't have to be a regimen that's really hard.
Like you'd have to do it 3 times a week and come in.
No, once we've gotten them to the level they need to be at, just as with exercise, then you don't need to be in there as much to maintain. If you wanted to improve, you would maybe be a little more rigorous, but just to maintain it, we've been able to do that with patients, seeing them once every 2 to 3 weeks with 5 minutes at a time.
Wow. So about 90% success is kind of anecdotal, but you've had
at least 90%.
Like a sample size is around.
I'm going to say 10 to 20.
Okay.
My recollection is not 100%, but I think 10 to 20, and we're underscoring the success rate because it's been significant. The only time where we've had a problem is if there was additional things going on with the patient with incontinence that had nothing to do with what the vibration treats.
Yeah.
You know what I mean? So I'll give you an example. We have a patient who has a severe corn allergy, which will also irritate the symptoms of the incontinence.
Yeah.
So if she accidentally ingests any corn products, it's gonna bring those symptoms back. Has nothing to do with this. But if she stays away from the corn products and she's using the whole body vibration, she has no symptoms.
Okay. And so now you've also had, right here, you've seen some anecdotal evidence for osteopenia.
Yes.
And bone density.
Yes. We started a study, and it's a long study. It's about a 6-month study that has to be performed. We started a study with a patient who wanted to volunteer to see if we could increase her bone density. She came to us with a grade 2 osteopenia. And she saw, within 6 months, she saw an 11% increase in her bone density, which brought her back into a normal range.
Yeah.
What's interesting about the treatment for the bone density is that the bone density actually will get worse at the 3-month mark, and then it significantly improves in the 4th, 5th, and 6th month. So you got to wait for the whole 6 months to see the improvement, and
really?
you don't want to check in the middle because it actually will get worse for a while. But then at the 6-month mark, it gets better. The results from the studies showed similar results to what we saw, and we're in the middle with another lady at the I think who will recheck in August at the 6-month mark. But it appears, that it what we saw coincides with the research, and it works, without any problem.
Wow, and that's huge because it's a big concern with
Yes.
women and even to some degree men, but more so with women.
Yeah, it's a huge concern because it can start to affect lower back issues and things like this. On top of just the normal concerns with osteoporosis, it can affect a lot of different health-related issues. And if we can maintain that normal bone density, that will allay a lot of different concerns that especially a female would see, in her 60s, 70s, and 80s.
Now, how does this help with? I read in some places that it helps with even just the spine with people with spinal trouble. It has some sort of, I don't know if you can say that it's going to straighten the spine up, but it has some kind of
what it'll do by strengthening the low back. That will have a profound effect on a lot of different problems because a lot of the different issues you'll see with people with back problems is just a lack of strength.
Yeah.
Especially with your elderly patients who don't get any exercise or specialized exercise for the low back. What this will do is it'll strengthen the muscles of the low back. It'll increase blood flow to the area, which is significant as well to get the nutrition to the disc for hydration and whatnot. And it also has an anti-inflammatory effect on the joints and in the low back too, which will also be significant. So it doesn't necessarily straighten the spine, but it'll strengthen it. It'll increase blood flow, and it'll also have an anti-inflammatory effect on the spine and the joints.
People that have like degenerated disc.
Yes, yeah. What it'll do. We have another treatment that we use specifically for the degenerative disc disease, but we use the Galileo as an adjunctive to strengthen it, to bring more blood to the area, and also for the anti-inflammatory effect. And that has proved very vital to the overall treatment protocol that we use.
That's the big machine.
Yeah, we use intervertebral disc decompression to actually rehydrate the disc fully. Or, it comes back to about 70-80% of what it used to be, prior to the patient having problems, which is typically enough to relieve most of their pain symptoms.
Interesting. Okay, so let's see. We talked about did we talk about the peripheral neuropathy? I think that's one of the.
Yeah, we touched on that just a little bit, and we've seen that anecdotally.
Evidence here. Yeah.
That's been really interesting with those patients because they come to us with two different problems. One is restricted blood flow as a diabetic in the neuropathy, also numbness and tingling. The other real grave concern that they have is a possibility of amputation at some point because the blood flow gets worse and worse over time.
Right.
What's been really nice here in the office is we've seen at least a 90% success rate with them as well. As long as they came to us with diabetic neuropathy, we've seen those cases resolve at least 50%, and in many cases 100% as well, where the full sensation came back and blood flow in all cases returned to normal. That wasn't a problem. The sensation can be a little dicey, depending on how long they've been numb.
Yeah.
If it's been 15, 20 years, it'd be a little more difficult.
Because with diabetics, with all the extra sugar in the blood, it seems to have a really deleterious effect on the cardiovascular system.
Yes.
And also, I guess, the nervous system. So they literally kind of start to lose feeling.
Yes.
Down in the feet and
exactly. The restricted blood flow will have a negative effect on the motor neurons in the feet.
And it affects the eyes too, because that those little tiny blood vessels in the eyes.
Absolutely.